Um, on the chat box, please don't stop introducing yourself. Let us know your name and where you are joining us from. Today, we're focusing on the role of AI in transforming healthcare. And my name is Joyka Rebakshu, and I'm your host for today. I'm excited to have you all here today on this call for this session. And I'm also excited to know where you're joining from. I'm actually joining from Ghana. So feel free to, let us know where you're joining from in the chat box below. I can see lots of persons joining from Ghana as well. I can see someone joining from Uganda. Yeah, so please keep it coming. I can see someone joining from Shukura as well. All right, so today's agenda. Yeah, welcome once again to the session today. And we'll be having a keynote presentation by Dr. Mustafa. And myself personally, I'm really excited and I'm looking forward to hearing from every speaker today. And afterwards, we'll be having a panel discussion. Yeah. And the panel discussion is really exciting for me as well because I get to hear from various speakers and their point of view, since they are all in various, demarcations, still under AI and healthcare though, but you get to see more and know more about that when we get to the panel session. Okay, so please feel free to also let us know your expectations for today's program. Um, I'll give us 5 minutes for that. Expectations for today's program. Someone is joining from Morocco as well, from Kenya, from Ghana. Welcome. Okay, so does anyone want to go with the expectation for today's program? I'll take just two persons. If you're up for that, you can always signify by raising your hands as well. And I just want to hear from you what your expectations are for today's program. I think I'm going to have to call randomly. Joy. Okay, we have Sheriff. Sheriff, please go on.
Yeah, so I'm very excited about the people who are going to talk on this meeting, and then I mean reading about them, and then the kind of thing they do actually resonates with this discussion. So I'm expecting to, I mean, look into the future, and then together with what they will say, I mean, project into the future and see how AI is going to actually transform healthcare as the topic suggests, and then how things are going to happen. And then, we all know just recently, Elon just broadcasted how cities are going to be run by his autonomous stuff. And then, yeah, so I'm expecting to see a similar thing in here too. Thank you very much.
Thank you so much, Sheriff. That's really insightful. All right, so I was actually almost calling you. Okay. Association, your hands is raised. So please go on. I was about calling you. Please go on. Thank you.
I appreciate this opportunity. I, uh, I got to know about this from my friend who is one of the speakers, who is a student at the same university where I had my bachelor, um, Mr. Abdullah Yukuba, and I really appreciate the conversation both about AI and the implications in healthcare, especially from an African perspective, because one of the questions that I've always had about AI is, well, we really have a big problem with infrastructure in African countries. So let alone talking about something as um, advanced as artificial intelligence. But at the same time, I think uh, the right way of going about it is doing it in parallel. We can't wait until we have the infrastructure for everything before we start. And so I hope that this marks the beginning of like very productive projects that hopefully can have great impact in our future. And I really, once again, appreciate the opportunity of allowing us to get the information and intel about this. Thank you.
Thank you so much. If there's anything I picked from what you just said, I love the fact that you mentioned that we don't have to wait. We can't wait till we have all the infrastructures before, we start learning about AI and applying our knowledge to the little we have, especially here in Africa. So thank you so much for joining us today. And we'll be moving over to the next item on the list, the next agenda for the day. Please feel free to let us know your expectations in the chat box, and we'll be on the lookout for that as well. All right, so we have our keynote speaker for today, Dr. Mustafa. Yeah, I can see him in the house already. We have our keynote presentation by Dr. Mustafa today, and he's the assistant professor in robotics and mechatronics at the British University in Egypt. All right, so Dr. Mustafa is an assistant professor in robotics and mechatronics within the Faculty of Engineering at the British University in Egypt. He obtained his Bachelor of Engineering as his BSc and his Master's of Science, his MSc degrees from the Mechatronics Department at Ain Shams University's Faculty of Engineering in Egypt. We are happy and we are glad to have you on board today, Dr. Mustafa. And we are also very excited to tap from your knowledge today. Please, you can have the floor. Thank you.
Thank you, Joy, and good evening, everyone. I hope we can transfer knowledge for transforming the role of applying AI in transforming healthcare in Africa. Let me start with the presentation. So, just a brief about me. I'm Dr. Mustafa Woz. I'm assistant professor in mechatronics and robotics at the British University in Egypt. My academic background, I got my PhD in robotics at the American University in Cairo, master's and bachelor from Shams University. My research focus mainly depends on micro nanorobotics, biomedical applications, and AI in medical applications and robotics. I have more than 10 publications in esteemed journals and conferences. Now let's start with the theme of the webinar today. It's about applying the AI in our life, but mainly in healthcare. So transforming the healthcare using AI, we need to explore the potential benefits from applying this in healthcare, the challenges we face in our continent in Africa, the healthcare problems we already have, in order to see how can we solve it using the AI. So what is an AI? I am sure that everyone here knows what the artificial intelligence refers to. It refers to the use of algorithms and machine learning models to analyze complex and medical data. Also, it enables us to simulate the human intelligence in order to recognize patterns for medical imaging, processing large data sets, and making predictions. And a small example for applying AI in healthcare is by medical image analysis, predictive analysis for diseases, virtual health assistant, and personalized treatment recommendations we can have from any application from AI in healthcare. The current healthcare challenges in Africa. Africa as a continent, our continent, faces many healthcare challenges. For example, inadequate infrastructure, the shortage in healthcare professional doctors, the limited access to medical services. Addressing this issue is very crucial and important for improving the quality of use and healthcare. According to the World Health Organization, there is about 1.3 doctor or physician per 1,000 people in Africa, and this number is far below the global average, which is 3.5 per 1,000 people. Also, a report from UNICEF and World Bank stated that 42% of the population in sub-Saharan Africa lives more than 2 hours far away from a hospital. So this is the second challenge for healthcare in Africa. Third one is half of Africa's population lacks the access to the essential, to the primary, basic healthcare needs or service. And finally, the hospital beds in Africa averages 1.3 hospital bed per 1,000 people as the IC unit. I am talking about the IC unit in this case, while the global average is 2.7 beds per 1,000 people. So the AI has the potential to address these challenges by improving the healthcare delivery, enabling telemedicine service, and I'm going to enhance about the telemedicine service in the next slides. Also, the AI can support the development of low-cost, scalable healthcare solutions tailored to the African population, to our nature of the continent. So, what are the key applications of AI in healthcare? It can be used in diagnosis, pre-diagnosis, telemedicine service, predictive analysis, personalized medicine, surgery, and robotic surgery. We can combine AI with robotic surgery. And finally, we can combine AI and IoT in hospitals in several departments, but will here emphasize in the emergency department. So, in the diagnosis, we can have an AI application in diagnosis by giving an application the medical data, the data set for a certain disease, and it's sure we can have a pre-detection. Another application I have mentioned is the telemedicine and AI integration. As I have mentioned before, that around 40% of population in Africa lives around 2 hours far away from a hospital. So they have the lack of access to the hospital. So how can we solve it using AI? By telemedicine. Integration between telemedicine and AI, we can have a proper solution for the people who are living far away from hospital. So patients in remote areas can receive the medical advice, reducing the burden on local facilities. So we can facilitate the burden on our government from building hospitals in the remote or rural areas by enhancing the telemedicine and AI integration. Another application is predictive analytics. By forecasting the disease outbreaks, we have all faced the corona outbreak. We need outbreaks in the continent, in the whole planet, not only in Africa. But we can have a forecasting for these diseases by analyzing the data which can be provided and allocate the resources so we can improve the overall service delivery. Another one is by applying it in a personalized medicine, by having a data set for an AI application to give a treatment for the individual patients based on their lifestyle, medical history, their lifestyle, and that approach enhance the treatment and minimize the adverse effects. Another one is by integrating the AI in robotic surgery, and this enables surgeons to perform complex procedures with a greater accuracy. This helps in minimizing the human error, improving the patient outcomes in surgery, the difficult one like cardiac operations, and so on. Finally, an application by integrating the AI and IoT in hospitals. So we can monitor, assess, prioritize emergency patients based on the severity of their condition. So we can ensure quick and data-driven decisions. This improves the patient management in the department. So the integration of both AI and IoT provide a smart, efficient, and automated solution for hospitals to manage the emergency patients. And we face this problem here in Egypt. And I am sure that every country in Africa faces this problem because we lack of the facilities. So we cannot prioritize which patient is now have the first priority or second priority. So by integrating AI and IoT on a cloud service, we can prioritize the patients according to their service. So after this, is there any opportunities for applying AI in healthcare in Africa? Yes, for sure, we have several opportunities. As mentioned before, we can relate the problem with the solution. For example, the problem with that we have shortage in healthcare professionals. So, and this is faced by several African countries. So, but the solution is by giving AI tools, we can help and analyze medical scans, interpret lab results. This allows less experienced healthcare workers to make decisions. This device here is called an IDX DR analysis, which is analyzing diseases related to the eyes, optography, and it is used in Europe now. So we don't need a medical professional doctor when we have this device. Second problem was the reachability. We have people who are living very far away from a hospital. They lack they lack reaching a near hospital to them. So we can solve it by AI-driven telemedicine and mobile health application. So we can expand healthcare access to the rural areas. And finally, in Africa, we have more than 2,000 languages. So this is a barrier between a doctor. Imagine for me from Egypt, I speak English. If I went to work as a professional doctor, for example, in Senegal or Morocco or Benin, they have the language is French. So this is a barrier. The more problem is, moreover, that African peoples have their own language, which is not easily to learn or easily to communicate with. So according to the statistics, we have more than 2,000 languages spoken here in Africa. So we can overcome this language barrier by using an AI. And we all use an AI translator. You just speak to the mobile phone and it translates right in the moment, at the moment, in another language. So this is another application for AI, which can improve the healthcare in Africa. So what are the challenges we face for applying AI healthcare in Africa? For sure, limited infrastructure, because AI applications need an internet, telecommunications, and we have limited infrastructure in Africa. Another problem is data scarcity and quality, the data quality. Even here in Egypt, if you want to make an AI machine learning model for detecting or for predicting a certain disease, you need a huge data set, but an accurate data set. And here in Africa, we lack this data quality in the medical sector. Also, the high cost of AI technology, because it requires a high capital while initiating it, but after that you will get the reward. Another one, when I was talking about the data sets, it is difficult to have it in Africa. What if I acquired a data set from Europe, from America, from China, from Asia? It will be inequality data set because people in Africa different from people of Europe, different from people from Asia, different from people from Latinos or Americans. So if we depend on our AI models on data sets from a continent different from Africa, it will give us a bad result, bad quality result. Finally, we have a lack of a skilled workforce here in Africa. That's why we are now having this webinar in order to address the youth to learn AI. We have to do all our efforts in order to enhance our skills in AI because it is like a train and it is moved and we need to catch it before it run away. This I will talk about two case studies for using AI in healthcare. One of them in Rwanda in 2016, they have initiated an application called Papillion. Papillion is an AI-powered telemedicine application. They have more than 2 million users in this application. This application has a chatbot which assesses the symptoms and connects patients with doctors directly through consultations. This cost-effective, scalable solution, and we will have a very, very high responsive feedback, no delay, no error, and this is applications that offer affordable for millions. And as I said before, more than 2 million are using this application in Rwanda. Another one is by using AI in Uganda. And a research team have developed an application which tells your doctor if you have malaria or not. This by using an AI application directly from your lab test. So what we can conclude from this is that we need collaboration between governments, healthcare providers, technical companies, researchers, as AI potential public-private partnership will enhance and drive us in more solutions. Let me introduce you this part of my research team, and I'm very proud of this research team. Engineer Amr, who is working on a research for detecting the blood glucose in blood and monitoring it in non-invasive technique without any invasive and storing the data on a cloud and sending it to your doctor directly so he can monitor your glucose in the blood. Also, Engineer Miran, which is working in AI-powered soft robotics endoscopy to can be used in a surgery, complicated surgery, for example, colonoscopy, neural surgery, uh, which is improving the accuracy in surgery. And finally, Engineer Zahi, who is working on AI parallel quantum robots to be used in not time surgery to be automated. This will facilitate the surgery, enhancing the quality of surgery, and to be able to make the not time in confined spaces. So the conclusion is by embracing artificial intelligence in healthcare can significantly benefit Africa. By overcoming its challenges, we can achieve more effective and equitable healthcare system for all. Thank you. And now I want to have your question.
Thank you so much, Dr. Mustafa. I've learned a lot today. Please let's give it up for Dr. Mustafa in the chat box. Let's appreciate him. Yeah, let's appreciate him, please. I personally have learned a lot from today's session. I love the parts of AI in robotic surgery for precision. Please, let's appreciate him in the chat box. And if you have any questions, please feel free to raise your hand. I'll take just 2 questions. So please feel free to raise your hands so that you can unmute yourself to ask your questions. And also feel free to drop your questions in the chat box below. So Dr. Mustafa can address the questions you have. Questions from the audience. I personally have a question though. Okay. Omari, yeah, your hands are raised. You can go on.
Hello.
Yes. Yes, we can hear
Well,
you. Please.
okay. Well, shukran, and thank you a lot, Dr. Mustafa. This is really eye-opening to know that we have already started working on this technology. I know that most of us only started learning about AI after the reveal of ChatGPT, like intelligence artificial models. Well, my question is, does this type of research require a lot of funding? And are we really seeing like hope in terms of like new policies related to funding for these sorts of research? Because we have seen this before with many sort of, you know, research and inventions that the fundings are really scarce. I know that the scientists can be very motivated and passionate, but at the same time, we need to, uh, keep it, be 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 uh, be kind of realistic and realize that research need a lot of funding as well. So that is one of the questions that I've been asking myself a lot, honestly.
So let me answer you. For sure, a research in any area, not only AI, needs a fund. But I guess the problem in this area, not the fund itself, rather than how can I say it, the the verifications and validations from the authorities, from the medical sector authorities, because you are going not replacing the doctor himself or a professional doctor with an application, but the way he can see it, he must say that he will assist it. So this is the main barrier between applying the AI in healthcare we are facing it. That's number one. Number two, regarding the funds, for sure, in any application or in any research area, you need a fund. But what about starting by step by step? When we have a good result, we will have a fund for continuing our research project. You will have a good proof to convince any authority or any research authority to convince them to fund your project. That's what we're going to do here. For example, in Egypt, we start by a prototype, a small prototype, and then we go for the higher level by moving this prototype to a real application. So we convince the authorities here, for example, the scientific research authority in Egypt, uh, by giving them our proposal, research proposal, which have the prototype itself, the design, the results, what are we expecting, what are we going to, how we are going to enhance it, what do we need to implement it. Uh, so this is the second step. But in my opinion, this is not the fund is not the big problem for research area. The big problem in this research area is the data set because you need an accurate data set for a certain disease. For example, the malaria. We need a data set for the patient who have faced malaria or have got malaria, their historical data. In Egypt, it is not legal to have this data because they consider it as a privacy, and cannot interact with their privacy or interfere with this privacy data. So this is a problem I face here, and I guess the same one in Africa. But in Europe, it is easy to get a data set from the authorities, from the medical sector. That's it. And thank you.
Thank you. Thank you very much. That was a very good answer. Thank you.
Thank you so much, Omari. Thank you so much, Dr. Mustafa. So I'll take the last question from Ajana. Your hands are raised, so feel free to unmute yourself and you can go on with your question. Thank you.
Hello, please, can you hear me?
Yes, perfect.
Yeah, I'm Ajana. So we always know that AI is being used in diagnosis and treatment. So I want to know how effective AI system in diagnosing disease are like better than professional diagnosing disease to us. And also, how do you see the collaboration together, like having both systems working together, human AI systems and human working together in diagnosing diseases? Yeah, thank you.
Thanks for your question. As I have stated before, the AI application diagnosis will not replace a professional doctor. It will assist him. It will solve the problems we face in Africa. As we have, you can, have you have mentioned in the presentation that in rural areas, more than 40% of population of African people lives far away from hospitals. So what if a man now have a disease or facing some symptoms, having a high fever? What is better for him? to go 2 hours traveling to a hospital, or by using a telemedicine application in detecting his disease or in diagnosing his disease. So it will assist the healthcare organization in Africa. It will not replace the professional doctors. It will assist him in diagnosis. It will also not only in diagnosis, but it can monitor him. As I have stated, one of my research student, is working on monitoring the diabetes, the glucose in blood, and monitoring it on a cloud by sending it to the doctor. So a doctor who is far away can monitor the disease for a patient who is at home. So no need for the patient to go to the hospital. In addition to that, hospital is already crowded with people, crowded with patients, and we lack for beds in hospitals. So the AI applications will not replace the doctors. It will assist the medical sector, which will enhance the healthcare in Africa. That's it. And thank you, Adjan.
Thank you very much, Prof.
More than one.
Thank you, Ajana, for your question. Thank you, Prof, as well. I think the question in the chat is similar by Kutina, and Prof has mentioned that AI will not replace the doctor's right, but we just make work more efficient for us. And since I'll be taking just 2 questions, feel free to relay any further questions you have by connecting with Dr. Mustafa. His LinkedIn link is in the comment section. So feel free to connect with him through the link in the comment section, and you can ask any further questions you have by sending it to him. Thank you so much, Dr. Mustafa. I've learned a lot, and thank you, Omari and Ajana, for your questions as well. All right, so we'll move to the next agenda for the day, and I'm also very excited for this particular part of the session today. So we'll be having a panel session, and the panel session will be moderated by Ms. Bao, who's the president of Youth in AI and the founder of EPDL Learning Training. So please, whilst our speakers are coming on board, feel free to celebrate them in the chat box, and whilst they speak as well, feel free to pen down your questions. You can send it in the chat, or you can raise your hands when it's time for question and answers to ask your questions. Thank you so much. Ms. Bao, please, you can have the floor now.
Thank you very much for the warm welcome. Joy, thank you very much. And that was a very wonderful presentation from Dr. Mustafa. It was very, very insightful. Yeah, and as rightly introduced by Joy, our next session is a panel discussion, and I'm really, really honored and excited to be moderating this session. And together with me for this session, we have very, very exceptional set of individuals who are doing amazing things, each within their own stream. And we deem it a very, very great pleasure to have them today. Joining me on this session, we have Paulina Boidiwa-Mensah, who is a medical doctor and also a data and AI practitioner. If you are with us, kindly can wave, you can put your video on if you can. Also, we have Frank Ezoa Kujo, who is a medical student and a health data scientist. Thank you very much for joining us, Frank, today. And finally, we have Abdullah Yakubu, a software engineer and graduate student at Zhejiang Normal University. And he is also a very exceptional person who is an AI for health researcher as well. Thank you very much for joining us today. So if you're ready, I would like us to hear from you, but first, to introduce the panel discussion or what we are going to talk about in this panel session. The topic is redefining healthcare with AI, an African youth perspective. And within this panel discussion, we are going to explore the unique opportunities that exist for young professionals. And as you can see how our panel speakers are today very young and exceptional individuals. So we'll be hearing from them their unique perspectives within the opportunities that lies in AI and healthcare today. Also, we would be looking at some of the barriers that they faced in each of them trying to combine the medicine field or the health field and then the AI field as well. Because as you can tell, these two industries are not really easy. They are, I don't want to say tough, but they are exceptional. And for an individual to be able to combine these two, you should know that they are very much on top of their game. And hopefully through this discussion, our panelists will share their practical experiences from their personal projects, their career, their studies, their hobbies, and so on. I'm really, really glad to introduce and to welcome our panelists today. And I would like us to hear from each of you. Can you kindly introduce yourself and tell us a little bit about what you do and how it's led you to where you are today? Paulina, I would like to start with you.
Well, thank you. I'll be on video in a bit, but I just got a call that I had to rush somewhere. That's why I'm not on video, but I will join shortly. But so for now, let me just introduce myself via audio. I hope you can hear me.
Yes, we can hear you.
Okay, great. So I'm Paulina Mensah. I'm a physician and data scientist. I also work in the field of AI. Until recently, I had been employing large language models in emergency care in Ghana, but currently doing my MSc in applied computational science and engineering at Imperial College London, because I wanted to, expand my skill set. So yeah, I've worked in the Ghanaian healthcare space for a bit. Whilst I was doing my housemanship, I was also working in AI in health research. So I have had experience in medical research, I've had experience in community health, in clinical work, and in actually building tech tools to help improve clinical practice. So that's just a bit about me. And I will turn on my video in a bit so that this can be a bit more engaging. Thank you.
Thank you very much, Paulina. That was very insightful, and thanks very much once again. Next, let's hear from you, Frank.
Hi, everyone. Please, am I audible?
Yes, you are loud and clear.
All right, that's wonderful. I'll be turning on my video. Okay.
Awesome.
I don't know if my video is working.
Yes, we can see.
All right. Thank you once again for the opportunity. So my name is Frank Ezwakujo. I'm a final year medical student with the University of Ghana Medical School, and I currently am also a health data scientist. I am also the co-founder of Canisa Health. So what we do is we are a digital health company where we offer personalized and comprehensive care to people suffering from hypertensive diseases and especially remote places in Ghana. So that's what I do. And I currently serve in the capacity of the Chief Technical Officer, being the main, actually I double as a Chief Technical Officer and then the Chief Medical Officer with my combined background in healthcare and data science. So previously I've worked in companies where we apply AI and data science into the field of healthcare mainly. And I think that's the best. That's a brief one about myself. And I'll be a doctor in a few months, so that's what I can add.
All right, thank you so much, Frank. Please let's celebrate Frank. And congratulations as well to you.
Thank you.
Okay. Yakubu, please, if you're on the call, you can briefly introduce yourself. Okay. Thank
Yes,
you.
hello. Can you hear me?
Yes, please. We can hear you clearly, loud and clear.
Thank you. Thank you for this opportunity. Hello, everyone. My name is Abdullah Yakubu, and I am from Ghana, but currently in China. I'm a software engineer and a graduate student at Jicha Normal University. My academic journey started in computer science. I did my bachelor's degrees in computer science at the same university in China here. So my journey started long ago. Well, my passion for applying technology to real-world challenges led me to exploring the intersection of artificial intelligence and healthcare. Sorry, here is a bit late, so I can't turn on my video. I was trying to do so, but I think so. I apologize for that.
All right. Thank you. Thank you so much. It's
Yeah,
really,
so
yeah.
I've been working on quantum resistant mutual authentication for Internet of Medical Things, which I'll be presenting in IAEA Health Conference in Japan this November. So my work is motivated by the need for skilled, scalable AI solutions in healthcare, especially emerging regions like Africa. I'm excited to share my experience and insights on how AI can transform healthcare today and in the future. Thank you.
Okay, thank you very much for the warm introduction, for introducing yourself, Abdullah Yakubu. And to kickstart our session for today, I would want to start with you, Frank. Could you tell us a bit about what your first step in getting involved with digital health and AI is? And from your introduction, you made mention of your cool project that you are on. If you could touch more on how you got started, your first step.
Oh, okay. Sorry for the feedback. Thank you so much for the question. So it all started, my interest and my journey into digital health and AI began in my first year of medical school. So previously I had some experience with programming. My main language was a C++ programming language. And when I entered into medical school, prior to the time, I saw both of them as in technical world and then the healthcare as two separate worlds I was fairly comfortable with. But in medical school, I had to make a choice. I had to drop one, so also I thought, and work with the other. So I spoke to a few colleagues of mine, and notable among them was a friend I had made in the first year of medical school. And he was an IT student, and it was through him that I got to know about the Python programming language and its applications through AI in healthcare. I read more about it and I decided I thought it was something that I could look more into. So I did that. I did some reading and research into the field, and I realized it was something that merged both worlds for me. And I was really interested in that merging because it was something I realized I was very passionate about. So I started learning as much as I could about AI and Python programming language. Then came COVID, where I intensified my learning and I had the opportunity I was selected as part of group of people for a special AI course by the Ranmila AI Institute by Darlington Akogo, which I'm sure many of us would know. And I think pretty much that was how things took off for me. And since then, it's been a very straight ride for me, I must say. Thank you.
Okay, thank you very much, Frank. That's very interesting. That's very exciting, and seeing how you really took the opportunity of the lag in time in the COVID and some other times as well. It goes a long way to show us that even within challenges, there are opportunities. Yeah, and thanks very much for sharing that with us. Next, I would like to hear from you, Abdullah Yakubu. As an AI for health practitioner and researcher, what excites you most about the future of AI in medicine?
Thank you for the question, Ms. Bao. Well, the future of AI in medicine excites me because of its potential to revolutionize patient care and make healthcare more accessible, particularly in resource-limited regions like Africa. AI can provide more faster, more accurate diagnosis, optimize treatment plans, and even predict disease outbreak. Recently we just had COVID. I know it was not easy, right? So the ability to personalize healthcare using AI, where algorithms analyze large-scale medical data to recommend treatment specifically to individual patients, is groundbreaking. Moreover, AI-driven health monitoring and diagnosis tools can bridge the gap between urban and rural healthcare services. In Africa, we have a lot of villages where we don't have those medical access. So we can use AI to bridge that particular gap and offering continuous healthcare where traditional infrastructure is lacking. Thank you.
Awesome. Thank you very much, Abdullah Yakubu. The challenge, especially within the rural areas in Africa, is really, really concerning. I'm glad that you and a lot of others, practitioners and researchers as well, see AI as kind of a very great opportunity to balance or to bridge that gap. And hopefully, as the session goes on, we will get to hear more exciting stuff on the best way to approach that. So thanks very much for sharing that with us. Paulina, are you with us? If you are, I would also like to hear from you again. And as a medical doctor, can you share with us how your journey with AI began and what really inspired you to explore the AI's potential?
And I remember whilst checking on the woman, making sure that I would be doing assignments on my phone, I think, programming as a machine learning assignment. So I kind of started combining tech with medicine from that stage. And I took it a bit more seriously. And then during house job, I was working in a research institute applying AI to health data science. And then eventually AI. And then after house job, I worked with a health tech startup for a bit, and here I am. So basically, that's how the journey has been.
Okay, I can see the journey has been very, very exciting for you so far. And as we still have you, I would also want to follow up with this, that how do you balance studying medicine with learning about AI and technology in general, as well as the courses that you're still taking at the moment?
Okay, so the thing is, I understand that this is how I go about it. I understand that at any point in time, I might have to focus on one thing better than the other. So there have been periods where I've done a lot more clinical work than AI work. There have also been periods where I've done more AI work than clinical work. And for me, that helps me to juggle both. I don't try and squeeze too much in a day, because I think I've realized that to have maximum productivity, sometimes you have to cut some things out. So for me, that's how I achieve balance. I'm also very, very stingy with my time. I am very selective about events I go to and then what I use my time for and who I hang out with.
Awesome. That's very interesting.
Because I know that time with yeah, that's how I balance both.
Okay. Thanks very much for sharing that. And in this current world, sometimes there are a lot of distractions all around us, and trying to balance either your work and your passion, or trying to balance both, can sometimes be challenging, and it's really interesting. And thanks very much for sharing that with us. I would want to hear from you again. Abdullah, can you share with us some of the challenges that you faced in building AI solutions for health?
Hello, can you hear me?
Yes, we can hear you.
Yes. Well, I've also learned from the doctor who had presentation, what's the name, few minutes ago. We have a lot of challenges building AI solutions. Some of the key challenges includes data privacy and security, particularly when dealing with sensitive medical information. You know how medical data is very sensitive. We don't want people to see our medical history, so it's very challenging. Ensuring that AI systems comply with healthcare regulations like the HIPAA and GDR is critical but complex, and additionally, access to high quality label data for training AI models can be very difficult in African context, because just like what doctor said, we don't have enough data. We are still lacking data. So where electronic health records may be scarce or incomplete, there is a lot of issues gaining trust from the healthcare professionals, and patients, many of whom are skeptical of AI systems, especially in Africa. We are still not in trust of AI systems. We are still learning. So it's really hard for people to just believe like that, And lastly, integrating AI into existing medical workflows and infrastructure require substantial resources and careful planning to ensure that usability and effectiveness, especially in Africa. Since we are still learning how to trust AI or how to use AI, it's really hard. And we are still working on this because, data privacy is really hard. Whilst we are trying to minimize this, well, we need to work with both professionals and then healthcare leaders. Thank you.
That's very interesting. The trust issues that exist.
Yes.
I know.
Yes.
With the issues of data privacy, all stakeholders get to be very concerned because, in as much as we are trying to build smart AI systems to solve our everyday problems, being able to protect the data that we use is very, very critical. And I know of a couple of institutions that are trying to, or that are kind of trying to find ways to bridge that gap. Yet,
yes,
the digital infrastructure might also be limited. So,
yes,
I also want to understand, per your view, what do you think can be done? Are there any effective strategies that you think we can use for getting AI innovations accepted and trusted by everyone, like the medical professionals and the community at large?
Yes, well, one effective strategy is maybe collaboration with the healthcare professionals from early stages of AI development, That is like you say, involving doctors, nurses, and medical researchers. That helps ensure that the AI solutions address real-world clinical needs and are user-friendly, because they need to understand what you are building and what kind of solution that you are producing. Not just come and say, oh, I'm developing AI models. I want to do this. I want to do this. No, they want to understand the system that you are building. It will really solve a particular problem, real world clinical needs, and is very user friendly. Building trust through transparent communication is about AI system works, their limitations and their benefit is very crucial. You need to let them understand this, because if they don't understand this, they won't trust it. It's also important to focus on education and training. We need to train healthcare, workers, medical researchers, doctors, and nurses. We need to train them, offering resources and support to medical professionals so that they can effectively use AI tools in their daily practice. I don't know if you understand what I'm saying. Finally, let's demonstrate the proven success of AI applications through case studies, pilot programs, and peer review research helps to overcome maybe skepticism and builds confidence in AI-driven healthcare solutions. I don't know if I understand, if I answer your question.
That's very awesome. Yeah, You really did justice to it. And I want to come to Frank. Frank, how do you think AI can address some of the major challenges that has been highlighted in Africa currently?
All right. Thank you so much for the question. I think Dr. Mustafa touched on most of them in his presentation. So some of the pertinent problems we face as a continent when it comes to healthcare, chief among them is a shortage of healthcare professionals. Then we can also look at another problem being limited access to medical care and infrastructure. And finally, how AI too can help us with improving diagnostic accuracy or, delivery of healthcare. I'll start with the shortage of healthcare professionals. I think Dr. Mustafa once again mentioned it in his presentation. As it stands now, Ghana, for instance, we have a very high doctor to patient ratio. That is 1:6,355. And that means that each doctor is taking care of averagely about 6,000 people. That's 6 times the average according to WHO, because it's supposed to be 1:1,000. Hello, am I audible, please?
Yes, you are. You are.
All right, thank you. What that means is that in addition to training more healthcare professionals into the system and building more health facilities to contain these professionals, we have to find the best way of optimizing the available, human resource to meet the demands of the health system. And AI plays can play a very significant role. I'm going to give a few instances. For example, we can rather than just making healthcare something that the people come to health centers for, we can take healthcare to them. And one way we can achieve that is through digital health, when we digitalize our healthcare services, and services such as telemedicine and chatbots and all these services that AI brings to show make that very possible. A very classical example is the prompt system. Prompt is an acronym developed by the Jacaranda Health Company in Kenya. So what that does is that it provides personalized and customized care to pregnant women, and it sends prompts and critical information about delivery, right, and childcare throughout the entire duration of their pregnancy and even to new mothers. So it keeps them very, very abreast with relevant, relevant information regarding obstetric and neonatal care. And what it also does is that, for instance, if any woman has any concern about anything that they may be going through, a symptom or anything, they get to send the system that message or through a call in any language of their choice. And what the system does is that it's an AI-powered triagent system. What triagent simply means is that it helps classify the presentations of these various women into those that require urgent medical attention and those that do not require urgent medical attention, so that for those that present with more serious and life-threatening conditions or issues, they are attended to immediately by qualified health personnel. And some of the queries that are more about everyday instances, like what foods they can eat and all of that, the AI model actually attends to that. So that's one way we can effectively utilize and manage the limited human resource that we have as a problem in Africa. Right. The next thing that I would want to talk about is, I think I mentioned it. So the next thing is with reference to limited access to medical care. So if you take a good look at it, you'd realize that the intervention like the Jacaranda one that I mentioned cuts across. It helps manage the access to healthcare and also deals with the problem of limited or shortage of health professionals, because that means that it's not every query that a doctor is supposed to respond to, especially if they are not available to. And most of the queries that do not require urgent medical attention is handled by the AI model, which is obviously vetted by qualified personnel. Next, I would also want to talk about the diagnostics and early detection of diseases. AI has played a very, very critical role in the early detection of certain forms of cancer, like breast cancer, where a lot of chest scans or mammograms are actually scanned or processed by AI models, and they're able to pick some of these early forms of these cancers way before they are visible to a human eye on actual manual observation. And it has saved us a lot of time in waiting for these conditions to become more advanced, where they will need to spend a lot more money and a lot of resources going to the manage at certain stages. But with the early detection of some of these cancers with AI, it makes early intervention and a good prognosis something that's possible. And so we have a few companies like Redify AI in Kenya, and they make some of these models for the early detection of some early forms of cancer. And here in Ghana, we have Mino Health AI Labs. It's one of the pioneering companies that is involved in some of the radiological scanning for the early detection of some these forms of cancer. I would end by saying this. For Africa, since it looks like we're lagging behind in the AI revolution, personally, I think it's because of our data management systems. As it stands now, we all know that AI runs on data. Data is the fuel of all smart and intelligent systems. What that means is that for any system to be labeled smart in the AI context, it needs to have been trained on sufficiently large data for it to be able to make, generalizable inferences. And for that matter, Africa as a continent, we need to spend a lot of time building stable, secure, and very, very robust data management systems. So these are essentially tools and services, and products that are very, very vital in managing, collecting, storing, processing, and even managing of data in summary. So we need very robust systems that can allow us to collect all the relevant data we need, store it, make it available for analysis, and to be available for us to build all the models that we need. And I think that's one of the main areas that we can focus on as a continent if we want to include AI, or if we want to have an advantage in the AI race. And as such, I think that's one of the main areas that as a continent we should be focusing on, building very stable and robust data management systems. And this would include for our health centers, having a very, very good data-focused health management systems for all of these telemedicine or e-consultation, chatbot products and tools that are available. We make sure that we have very, very stable data management centers that can actually store and keep all the data that we can generate, so that in the event that, when we want to build models that work in our local context, speaking of AI models that can scan images and then make inferences, as I've mentioned before. So I think that's something that is very, very important if we want to tackle all these problems that we have mentioned in Africa when it comes to how AI can make a difference. Thank you.
Thank you very much, Frank. It's really, really important for us to pay critical attention to the data centers or the data management centers that is going to hold and upgrade whatever systems that we are trying to build. Thank you very much for that info. And I would want to hear from Paulina. Paulina, per your view, what are some untapped opportunities for young health professionals to get involved in AI for healthcare?
So one thing I'd say is that here's the good thing about being in Africa. There is a lot of opportunity. And why am I saying that? Because there are a lot of problems around us. A lot of the times when I have young people come and then ask or talk about they want to be involved in AI and health, I realize that a lot of people just really like talking about it instead of actually doing the work. For example, we are complaining about data not being available. One way you can contribute is to collect data in wherever you are around you. Let me give a practical example. There's this company called Intron Health, and they were looking for medical students and physicians, and even just general contributors to their audio data to train an AI model. And they advertised, and then initially there were so many people who seemed interested, and then talking about I want to get involved. But then eventually the engagement went down. And this is it was something for Africans so that these AI models can understand African languages and accents. So there are opportunities to get involved all around you. When my first role, I actually started as a volunteer. I went to the institution and I told them, this is what I can do for you. This is what you guys, this is where you guys want to get to. And this is how data science can help, right? The role was not existing, but I went to the leader then. I said, let me volunteer. Let me just work with you guys for some time. I'm so sorry, it's noisy here, but have to manage. Let me work with you guys for some time. And then they saw the value in what I was creating, and they decided to pay me, and they paid me, I mean, pretty well for Ghanaian standards. So there are many opportunities. For example, Frank talked about applying for Rumela Institute and then getting involved. There are a lot of opportunities these days. Put yourself out there, get connected on social media, on LinkedIn, on any other. I mean, there are WhatsApp groups for enthusiasts, there are Discord groups. Put yourself out there and don't expect to be spoon fed, and be willing to actually do the work, not just talk about it. Yeah, so I know I've been rambling on for a bit, but those are some of the opportunities at point out.
Wow, that's very insightful. That's very, very insightful. I mean, within Africa here, anytime you turn around or whichever direction you turn, you see more problems than solutions. So I really, really enjoyed the call to actions that you gave here today. And it's very, very necessary for each of us here to put ourselves out there. I mean, if you don't believe yourself in the first place, I don't think anyone would come and believe in you or in your capabilities. So I think that if you have like a certain kind of skill set and you think, or you know that it's needed elsewhere, you should really, really put yourself out there and make it available. Thanks very much for that insightful thought, Paulina. I would want us to draw back to you, Frank, again. Can you share with us some resources that you can recommend for us today for young professionals interested in exploring AI?
All right. Hello. Thank you so much for the question. So for resources, I think I'm going to group them into I'll start off by saying one of the first things I would recommend about getting into AI for professionals, especially health professionals, is first and foremost to familiarize yourself with the field. I would recommend going online, following some of the people you know are thought leaders in the field, to do your own research, get a good idea of what's happening around the world, with regards to AI in health. Because as you know, the more you expose yourself to it, it builds the interest. Without adequate knowledge of what's about and what it encompasses, it would sound very vague to you. So that's the first thing I recommend. Be abreast with what's happening and how AI is making impact in the healthcare sector. The next thing to do is that would help build your interest. And from there, you can apply, I would recommend taking online courses. That was one thing that helped me, before I had any formal institutional experience. I started learning it by myself. I took a number of online courses. So you can start with Coursera. They're very good courses that are organized by deeplearning.ai, by Michigan Institute of Technology. There's so many. So just go through these courses. They talk about AI in healthcare. They'll give you some projects. It will give you hands-on experience. That's the next thing I want to talk about. Get your hands dirty. Don't just, like Dr. Paulina was saying, don't just talk about it. Know how it's done. Build the skill set, not just the knowledge of the concepts. It's very, very important that you have actual hands-on experience. And so those courses would be a good way to start. Then you can go to online platforms like, Kaggle. There is Kaggle, there's Zindi. There's Kaggle and Zindi for data sets. You can just look for health data sets and try practicing some, build some models, analyze the data, try and draw inferences, try and draw some graphs, try and apply the skills you're learning to the data. And all these things are ways of building practical experience. And for those of you that are also good, or you prefer learning through books, I think one book I would recommend is Deep Medicine by Eric Topol. It's a very good book for getting started into how AI is making impact in healthcare. There are so many other books that talk about, so many books about that help with building practical skills. And for the online platforms, I must say there are other platforms that actually help you build hands-on experience like DataCam. For me, that was where one of the first places I started with, and it was so helpful. So that's also another thing to keep in mind. The last two things I'll talk about is join a lot of conferences like this one. You'd get to meet like-minded people. They'll share their experiences. Now, people's secrets are in their stories. So they'll tell you how they went about it, what they did, the things that helped, the things that did not help. You get to hear about opportunities. You go for programs like Deep Learning in Daba, which is a very, very helpful program. It's organized once a year. It's about AI in general, but you'd meet a lot there. That for last year and this year, for instance, there was a workshop on AI in health, which was so helpful. There's so many communities like that where you get to meet like-minded people, you get to build your skill set. The final thing I'll talk about is have a mentor. Have someone who you can talk to, have someone who can guide you. The field is so vast and so broad. At the very least, have someone who can direct you on what to do, especially for healthcare professionals. Because sometimes it can get a bit, permit my language, lonely. For me, I was in medical school and everyone around me was becoming a doctor. I was a doctor, I was a consultant, almost no one was into the field that I wanted to be in or had interest in. So I had to pull myself from the ground up, and finding a mentor played a key role in that aspect because at least I had someone who could relate with my interests, someone who was already there, and someone who could guide me take all the necessary steps so that I don't waste time. So these are very critical things. And I believe that if anybody wants to get into healthcare, these things would be a very, very good way to get started. Like Dr. Paulina said once again, there are so many opportunities around. You can look at Blossom Academy. It's a good place. I had my AI fellowship in Blossom Academy, and it was a very, very good place for me to build my skill sets as well. So these are some of the few things I can add from experience that would be helpful resources for anyone looking to get into AI. Thank you.
That's so lovely. That's very spectacular, Frank. And it's very, very important for us even this day that wherever you turn, you can find information. There's information vastly available to us, and it's upon we ourselves to be able to leverage on that and make the maximum or reap the maximum benefit out of it. And that's why we at Youth in AI, for instance, are really, really not backing down with promoting, AI knowledge, creating the maximum awareness that we can within Ghana and Africa as a whole. And even with some of these specific industries and use cases that we see these days, we realize that, AI really, really has the potential to solve some of these major problems that we have. And as you rightly shared as well, networking is really, really important. Networking is really, really important because there's a lot to reap from collaboration. There's so much benefit to reap from collaboration. And very, very much insightful as well. So thanks for that input. Okay. Now, I would like to come back to Paulina again, and just to try to wrap up the session as quickly as possible so that our attendees could also have some questions that they could ask. And I want to ask Paulina, if you were going to start your career journey all over again, like all over again, what would you do differently?
Probably start early, or start earlier than I did. Yes. I would also, I think I would have find a really good team and joined them to build. And I think you learn a lot building from a team with a team. The thing about the tech world is that a lot of the work you'll be doing would be in teams. So it's good to learn how to build in it.
Okay, awesome. Thanks very much for sharing that with us. All right. And now, as we are moving towards the end of the session now, I would like to go around with this final question. What final key takeaways can you share with our audience today? And I would like to hear from you, Abdullah.
Thank you, Misbah. Thank you for the question. Well, the key takeaway I would like to share is that AI has the potential to fundamentally reshape healthcare, by making it more efficient, accessible, and personalized, especially in regions like Africa, where healthcare systems face significant challenges. However, the success of AI in healthcare will depend on collaboration, as we spoke about, between researchers, doctors, nurses, and healthcare workers, between technologies, healthcare professionals, and policymakers. If we work together, I think we can overcome obstacles like data privacy, trust, and infrastructure limitations. It is also crucial for young professionals like we all those here, especially we those in Africa, to embrace embrace the opportunities of AI. AI, it has so many opportunities. So we need to embrace the opportunities that are coming on our way. If you don't know what to do, Google, search online, what can AI offer you? Try to at least explore, even if you're not interested, just explore and see how AI can do things. It's amazing. So continue learning and innovating while being mindful of ethical considerations. Because AI, even though currently they are still regulating AI, we are still not sure how safe AI is. So AI is a tool, and its effectiveness in healthcare depends on how we design and implement it for the betterment of society. Thank you all. Thank you for joining us today. Thank you.
Thank you very much, Abdullah. And it's really exciting, the kind of influence that you are making on that note. Thank you very much. Next, can we hear from you, Frank? What final key takeaways can you share with us today?
Okay, thank you so much for the opportunity. I'll start by saying that the impact AI is having on healthcare is very, very promising. AI is revolutionizing healthcare, especially here in Africa. It's improving diagnosis, it's helping us with resource management, and it's expanding access to care, as I mentioned earlier. I think for that, it's important to note that continuous learning is therefore essential. What I mean is, it's important to be very, very up to date with the current trend of AI, to know how it's making strides in this industry and how we can position ourselves to benefit or to contribute meaningfully to this, nexus. Also, for that matter, since healthcare is a very practical and a field that has high stakes, where the stakes are human life. For that, we would need to really, really be interested in the real world applications of AI. So it's not just about learning theory for a healthcare professional. It's about how these AI models or AI in general can be applied to real world scenarios to make actual clinical impact. And for anyone looking to get interested, I think you can start small, but think big. So like we've spoken about, take a course, join a boot camp, take an online degree, take an online course, be interested in doing projects. Look out for internships or projects where you can apply, AI in real world healthcare scenarios, because like I said, hands-on experience is very key. So these are things that we should keep in mind. So start small, think big, have the broader goal in mind, and that at the end of the day, we want to use AI to improve patient outcomes and also, improve public health. And I think these are important things that we should keep in mind as we seek to advance AI in healthcare. Thank you once again for the opportunity.
Okay, thank you very much for your final words. Finally, can we hear from you, Paulina? What final key takeaway can you share with our audience today?
One final takeaway, right?
Yes.
Okay. So then I'd say that consistency is better than intensity in this journey. There are a lot of people who start with so much enthusiasm and excitement, and then they stop too prematurely, and then they get distracted by something else. The truth is, if you really want to make a mark in the field, you have to be consistent. You have to stay focused, and you have to try and do at least something little every day. It's better that you take little steps daily than to put off things thinking you don't have time, and then you think you're going to use 1 weekend or 2 weeks or something to do a sprint. I've been in various situations where um I've seen people do that and it doesn't end well for them, and then later they complain. So if there's anything, be focused, be consistent. Um, and there are a lot of resources. Actually, sometimes it even gets confusing. So the problem is not about the resources. The problem is about having people who really, really want to get things done and will be consistent enough to get it done. It's always easy to talk about it. Sometimes people think the more they talk about it, the more it shows that they are really involved. Talking is not the way to show involvement in AI in healthcare or whatever field you want to be in. It's really about producing results. So then get to work and be consistent.
Thank you very much, Paulina, for the insightful words. And I want to take a moment to, on behalf of our audience today, really thank our panel for the awesome discussion and for really, really giving out their all. It's been very, very insightful, and I really cannot appreciate you enough. Thank you very much for also responding to our call to join us in this discussion. Thank you so, so, so much. Thank you very much. Okay, and now I would want us to have an open forum, and it's great that we still have Dr. Mustafa. So if you have any question, this would be the time to direct or to ask your question. I would, before handing over to our host for today, I would want to pass over to Dr. Mustafa so that we can hear some few words from him as well. So over to you.
Thank you for this webinar. At the end, I would like to share my thoughts about AI as my colleagues have mentioned, Paulina, Frank, and Abdullah. My advice for the listeners is just to start doing the research. And step by step, you will reach a final project, a final prototype that can be implemented, whether in healthcare or whatever the sector you are going to apply AI. As Abdullah have mentioned, AI is a tool. It's a tool, we can use it. We can have the most benefit from it. So we will deal it with a safe tool until we face another problem. That's it. So we have to start with learning, gaining experience from experienced people, taking courses, uh, participating in webinars, participating in internship, and I'm sure it's just a step to go to climb the mountain. It starts with a step. Thank you.
Okay, thank you. Thank you very much for the words as well. So there are some questions in the Q&A, in the chat feed that I would want to pass out to our speakers for today. The first question is, as a layman interested in technology, I want to know how AI is different from virtual reality. So I think anyone in our speaker list today can take this up.
Can you hear me?
Yes, loud and clear. Please go
on. Okay, so AI makes machines smart, enable them to learn and solve problems and make decisions like human beings. or like humans. Whereas VR, it creates a mesh like simulated environment that people can interact with through devices like headsets. So in simple layman understanding, AI focuses on intelligence, whilst VR focuses on creating virtual experiences. I don't know if I answer your question.
Okay, Sumaila Awal, is your question answered? Okay, I'm sure it is, because as a layman myself, I think this makes very much sense. Yeah. Okay. Okay, there's another question. Okay, I think this one is an insight from Joy Adevu. Ghana is building a data center adjacent to the Accra City Car Park beside the telecell office. Okay, thank you very much for sharing that with us. And the next question is from Okai Peter. So this question is directed to Mr. Frank. Let's say I want to solve a problem in health with AI. Now, what kind of data set can I get? Because, for example, I want to solve cancer issues. What kind of data sets do I need what kind of data set do I need to be able to integrate it into my work? So I do that. Or so I can do that. Yeah, so this is directed to Mr. Frank.
All right. Thank you so much for the question, Mr. Peter. So thank you for, it's a very good question. So you have a problem you want to solve in AI. Let's use the instance you gave. You give cancer issues. The first thing to keep in mind is that there are so many data sets available in most of the health problems that you may want to tackle, especially if you're now learning, and building your skill sets in AI and data science. So you can go online, like I mentioned, to Kaggle, to Zendy. There are other platforms that provide free data sets that you can use. And what you can do is that, so it depends on the type of problem you want to do. So if you want to solve, for example, breast cancer issues, is it a computer vision problem? Is it a natural language process problem? You have to know what domain it falls under. And then when you go to these data platforms, you can actually get data sets curated along the lines of the problem most likely you're interested in solving. Then you can download the data set and attempt it. Usually there are competitions that may be in line with, that may actually be active and ongoing, that may be in line with what you're doing and have the data sets that you have in mind. You can practice a lot with these data sets. Now, there are also people, experts in the field who have also attempted these same problems and have made their solutions available. So you can also learn with that and build alongside them. Now, this is what you can do for personal projects, for developing your skill set and what have you. The next thing you can do in applying, because that's as close to real life situations as you can get. The next thing that you can do to build on that would be to, after building your skill sets enough, is to probably find an internship opportunity to sort of do if you have the time. If you have the opportunity to work with a health tech center, for example, or any startup or company that actually uses AI or data science in healthcare, it gives you so much experience that you can benefit from. I'll use myself as an example. So one of the first internships I did was with MDoc Healthcare. It's based in Nigeria. As an intern, I had to analyze a lot of data from cancer patients who are on the Roche and Janssen programs. And I also had to build data sets and also build models to predict all sorts of parameters. If I were doing that on my own, yes, I could get a few data sets from Kaggle, from Zendy, but this was real data I was working with, and I actually had to work my way through it. So it gave me so much experience because most of the data, it's raw data, has not been edited or it has not been, cleaned nicely like the ones you find on Kaggle and Zendy, because most of them are for competitions or are from people's own research or personal projects. Most of them are cleaned data. So that's the difference. So you can start with that. But as I was saying, if you have the opportunity to work with a health company that is actually AI based, you get so much experience, and that's only if you've built enough experience to actually work with them. So that's what I can say to that effect. And I don't know if that answers your question. Thank you.
Okay, thank you very much, Mr. Frank. The next question is geared towards Mr. Abdullah Yakubu. Most of the remote areas in Africa that do not have access to healthcare is also associated with low or no internet connectivity. So in this instance, is it possible to build an AI that even without connectivity can still be used? Yeah, and this geared to Yakub Abdullah.
Thank you. Thank you for your question, Mr. Idris Muhammad. Thank you for your question. Yes, it's possible. AI can be deployed locally on devices like smartphones, or edge devices, where it processes data without needing constant internet access. So this way, AI-powered healthcare solutions can still work in remote areas with limited connectivity. So maybe we can use smartphones or edge devices that doesn't need internet access or connectivity. That way, we can easily deploy AI models in local devices to remote areas in Africa. So it's possible, yes. I don't know if I answer your question, Mr. Mohammed Idris.
Hello, everyone. I hope you can all hear me. Thank you so much. I've also been able to learn a lot, especially from the panelists, and it's also great to see how we are all airing out our views, right? Especially in the issue with underrepresentation in Africa and the open-mindedness of African data sets to solve healthcare issues using AI. I've also been able to learn a lot today from Paulina, from Frank, from Yakubu, from Dr. Mustafa as well. And thank you so much as well for everyone making the room interactive by asking their questions. I think someone's hand is raised up, so I'll just give it up for the person to ask the question. Okay, Peter, please go ahead with your question so we can, move into other activities for the day. Okay, we can hear you, please. Hi, Peter. Can you hear? Yeah, I can hear you, but your background is a bit nice. Okay, okay. All right. So, any further questions you have, please feel free to pen it down for us in the chat group. It's just emotional, but it's also insightful and exciting to see young Africans as we are now, young persons, youths being interested in AI and how it impacts our healthcare systems. And not just that, also identifying that here in Africa, there are lots of issues, right? Especially with the healthcare, there are a lot of limitations we have. So we're interested in AI, quite all right, but then how can we harness the knowledge, the skills, the trainings we are getting on AI and implement it on our healthcare systems, right? Due to the limitations we're already facing, right? There are a lot of more privileged countries, right, who have access to, you know, the equipment, the facilities needed. But just like Dr. Mustafa said, we don't have to wait as well for all these to be provided for us before we start implementing. So I think little by little, in our small corners, some of us are researchers, some of us are doctors, some of us are medical students, right? Some of us are AI and machine learning engineers. We can all come together in our various ways, right? Because the AI engineer also need this data set. So the data scientists in the room as well can also help us out there. So I'm just trying to say that we all have a role to play, and it's nice today to hear from everyone and to see everyone so interested and laying out their complaints. It's just emotional, but it's beautiful at the same time, right? All right. So yes, definitely. We'll get to send you the contact informations, right? Of every speaker here. Feel free to reach out to them on LinkedIn as well. We'll be pushing that to you. And to get first-hand information, please join the group. We have a group, so we'll be sending out mail as well. So please join the community on WhatsApp. So you get to also interact with persons of like mind, right? Maybe work on one or two projects together, and it'll really be helpful. Thank you so much, Omari, for gracing us your presence today. We'll send across the speakers, right, the informations to you so you can reach out to them for any personalized information you have, or any project you're working on. It would really be insightful. Okay. Miriam is asking, how do I link AI in the physical world, such as helping solve problems like air pollution, since it's a major problem now in my community? Okay. Okay. Oh, wow. This is an interesting question. And I also have a question from Okai Peter, and he's asking, if you're working in a group, right, and then maybe two people are in the remote areas with low internet connectivity, and you have about 10 gig of data set to download. Now, how can those guys in the remote area also access that same particular data set since they won't be able to download the data of that size? Can someone download and share with them? Okay, that's an interesting question. Yakubu, please, would you like to address that for us?
Yes.
Thank
Can you
you.
hear me?
Yes, please, we can hear you.
Yes, someone can download the data set and share it with them. But if they are too far, maybe let's say intercontinent, maybe, to make it easier for those in remote areas, you can use external storage devices like maybe USB drive or maybe hard drive to physically share the data. Or alternatively, maybe we can compress the data set into smaller parts, Nowadays, we have so many systems where you can compress the dataset to smaller parts or use offline file sharing apps that works over local networks without internet. For example, we have one that we call Share It. I don't know if we heard about that. And we also have LAN file transfer. You can use those apps to share data locally without internet. So we can use those kind of apps to share data to other people in a remote area who doesn't have internet access. I don't know if I answer your question.
Oh, wow. That's great. Yes, please. I think who the person who asked this question, right? So that's Peter. Please, you can also reach out to Yakubu as well to get some of these resources, right? And we would also try as much as possible to share resources on the groups as well. So if you know other maybe forms of compressing data or sharing data, maybe as a researcher or a data analyst or a data scientist, please feel free as well to let us know these sites or the methods you use. It will be really, really helpful. It'll be really, really helpful. Okay, thank you, Peter. I'm glad you understand. Thank you so much, Yakubu, as well. I'll just take the last question. I think someone's hands was raised. Josephine.
Yeah, thank you so much. I really joined quite late and I enjoyed the session. Well, I'm just curious. I want to know how I can stay connected to this network. I saw the link on another page, Girls Talk Cooperation, and I tap on it to join the conversation. But I want to just know how I can stay connected to the network. Thank you.
All right, great. That's a very, very interesting question. Okay, so we have a community, right? And we also have a WhatsApp group as well. And could you please text me, like just personally, in personal chat here, you can just drop your email to me. Like you can send it to me personally on the Zoom chat right here. So I could just add your email to our database. Then you get to get first-hand information, including links to join our WhatsApp group and also connect with more persons of like-minded of same interest there. I think that would really help. All right, thank you. Received. All right, so for the last question, I think I have a question here concerning air and air pollution, and I think Miriam, you're relating this question to respiratory disease, right? Right. Okay, so please feel free to drop your email addresses. I'll be glad to, reach out to you all and also add you all to our network. Right. Okay. Yeah, so concerning the last question I'll be taking because we're already far behind time. Frank, please would you like to do us the honors?
Thank you so much for the question. So when it comes to using AI, I would like to start off by saying that AI is a tool and not a solution in itself. So I like the structure of the question. When it comes to any problem that you are looking to solving it with AI, the best thing you can do is to really make sure you understand the problem. So she gave the person, Ma'am gave an example by saying like air pollution, since it's a major problem now in your community, you want to make sure that you've really understood what that problem actually is and what it means. Air pollution is a very broad problem per that statement alone. So, for example, what exactly about air pollution do you want to deal with in your environment? You want to, for example, like you said, you want to minimize the canker. That's the main that's the main issue you have with air pollution in your vicinity. So you can start with, like, I was trying to understand the problem. So what are the major causes or contributing factors of air pollution in your community? Is it from people who use these local co-pods, or what are or it's from factories, or it's from burning of rubbish, refuse, waste? You really need to know what the major contribute the major what contributing factors to this problem is. It is based on that you can decide the best solution to this problem. Because if you read, like, what I want to say is this: so many times it's easy to fall into the trap of looking for an AI solution when it's not the best solution for a problem. So you want to be sure that you really understand the problem. You really understand the solutions that are most feasible for that problem, and deciding if AI is going to help. For example, if, let's say, you build a model that can accurately detect how much pollution is in the air, that's a very great project. But does that solve your problem? Not entirely, but that can be something that contributes to the bigger solution of the problem. So that could be something that would help, for example, detect areas where the people there are at a higher risk of, getting some respiratory conditions or what have you, in order to target an intervention that you may have in that regard. So what I'm trying to say is that the first thing that you want to do is to convert that problem you've identified to, I want to say, a research question, as in what are the best solutions for this particular problem after you have really understood the problem, and to see the various places where AI can help. And you can only know that by going online and seeing how AI is actually being used to solve that same problem in other places. Then you can actually see what you can implement in your local, with a particular problem that you're solving, based on the resources available to you, the skills, your technical expertise, and you can start from there. Because sometimes the problem is so multi-layered that AI may not solve all of it, but can solve some of it. That's what I have to say about that. Thank you.
Thank you so much, Frank. Thank you so much. I've learned a lot from this as well. Yakubu, please we'll go with you next, and so that we can call it a day because you're already behind time. Thank you.
Oh, yes, Frank, thank you for your insight. I wanted to add something to her question. I don't know if we still have some time.
Please go on. I'll give you some time.
Thank you for that. Well, for the air pollution problem, maybe let's say you can't link AI to physical world by using sensors, sensors and data to monitor air pollution levels. So here is how AI can help. Maybe we can collect data using sensors to collect the real-time data on air quality, the air levels, and then we can then analyze this data to identify the air pollution patterns. And then we can predict future air quality based on the weather conditions, traffic, and industrial activities. And then based on that, we can now recommend actionable insight, like suggesting optimized time for outdoor activities or helping city planners to design better traffic and industrial zones to reduce emissions. So, and then based on that, we can also use AI systems to control air purifying systems or alert authorities when the pollution levels rises. That is, we can trigger responses like traffic control or emission reductions. So in short, AI can monitor, predict, and automate solutions for air pollution to improve public health care. Thank you.
Thank you so much. Wow, I've really learned a lot today. Right, I've really learned a lot today, and I hope everyone here has too. I can tell that everyone is so interested, right? And seeing that we are all ranting about the issues we are facing in Africa, right? As a group of persons and individually as well when it comes to the healthcare. And we are also looking forward to how we can solve Africa's problem, right? Specifically, Africa's problem, and also, work on training data sets, right? Training models with data sets that are Africans, like, Africans building for Africans, so we can be able to solve our own problems. So thank you so much for being here today, Josephine. I hope you got cleared, right? Because we shared the ways you can connect with us as well. So please feel free to connect with us. Our information would be here on the screen. You can reach out to us via email. You can, follow us up on our LinkedIn as well. And also you can also reach out to us on WhatsApp as well. So we'll be glad to have you. And I took down the mails as well. So we'll be reaching out to every one of you. Thank you so much for your time here today. Thank you for being here today. I'm happy to have been here today and to host this. I personally learned a lot, and I know we've also learned a lot. Thank you so much for our speakers as well, for honoring us with your presence and the knowledge. My God. Thank you all so much. You're really motivating us to, do more and also expand our horizons. And thank you as well, using AI for this opportunity. So please be on the lookout, right? The last series we had was AI and agriculture, and you never know what to come up next. So no matter what field or industry you're interested in, there's always something for you when it comes to using AI and the series we are offering. So please be on the lookout, and also tell a friend to tell a friend. Right. So no matter what industry you are in, something for you here. So do well to join our community and also reach out to us if you have any concerns or any further questions. We'll be sharing the information of the speakers as well. So thank you so much, our honorable speakers, for being here with us today. We love and appreciate you and your support and the knowledge you've given to us as well. Thank you.
Thank you for having us.
Sci-fi is something that will happen in 100 years, and lo and behold, we've seen the advent of drones in our lifetime. We've seen driverless cars. We've seen the emergence of robots. We've seen Alexa doing magic, for us in our homes. So this is definitely a friend. The ability to digitize any other segment of our world, including intelligence, it's an amazing opportunity for Africa, and I think the youth in Africa definitely should take advantage of it. When you think about the journey of digitization that we've gone through, from the typewriter to the current word processors and the mobile phones, you can see that there's been a lot of progress made. And the human generation, the human ecosystem that we live in, this particular dispensation requires that we use time for what time was meant for. And, living in this universe requires us to spend time with human beings. And requires us to enjoy life, to enjoy the ocean, to enjoy the forest, the greenery, basically the whole Garden of Eden, concept. And I believe that because time is so precious, productivity becomes an important element in our world. And productivity has a lot to do with the tools that we use to achieve these levels of productivity. I would imagine that all of you are using your cell phones to record phone numbers of your loved ones, and you're able to save time. If you need to call someone, you don't have to memorize or repeat the memory of this phone number. You're able to quickly, punch the number, punch the name of the person, and boom, dial the number. That has basically improved your life in one particular way or the other. If you think about hailing, ride-hailing cars today, from your phone, you can quickly locate the car, and boom, you're good to go. So we've digitized quite a lot of things, and I think the next level of digitization is going to be digitizing intelligence, right? What we say and how we reason must be digitized. And I think AI potential to mimic our human neural network and bring about some element of productivity to our day-to-day operations. Now, these day-to-day operations is going to definitely change the way we free time. You know, things that we can do in 10 hours could be done now in 10 minutes. And we will be able to free more time to spend time with human beings, loved ones, and you know, enjoy the hobbies that you all enjoy on a daily basis. So just a few words on how we can scale our human productivity, how we can scale productivity, how we can scale intelligence is basically what this AI capability is about to do. So we're basically digitizing intelligence. Now, there are a few technological layers involved. And for you youth in IT, you know, in AI, I think one of the cool things you want to ask yourself is, where should you build your career? What should you do at this point in your life that the AI is with us?